In this video, we are going to be talking about a nutrient that over 75% of Americans are not getting enough of: vitamin D. Vitamin D is both a nutrient and a hormone. Every single cell in our body has a receptor for it. It helps to regulate over 2,000 genes and is critical for our immune health, disease prevention, our mental health, and more. In this video, we are going to talk about the difference between vitamin D3 and vitamin D2, why it is important for our health, why most people are deficient in it, and how we can fix that. Hey guys, welcome back to my channel. If you're new here, my name's Kate. I'm a health coach and I post videos on a high-fat, nutrient-dense way of eating. If you like this video, please give it a thumbs up, feel free to share, and make sure to subscribe. And make sure to follow me on Instagram, Twitter, and Facebook, where I share new posts every single day. Welcome to episode 3 of my series, Nutrients We Are Not Getting Enough Of. In episode 1, we talked about salt. In episode 2, we talked about iodine. And today, we are talking about vitamin D. Like I said at the start of this video, every cell in our body has a receptor for vitamin D, and this means it's important for so many functions. Right now, our immune health is a really important topic. We want our bodies to be able to prevent and fight off virus and disease. And I'm going to go into exactly how you can use vitamin D to optimize your immune system later in this video, so make sure to stick around for that. What is vitamin D? Vitamin D technically isn't a nutrient at all. It actually acts more like a hormone within the body. Our bodies create vitamin D when UVB rays hit our bare skin. Sunscreen blocks these UVB rays, so if you're out in the sun with sunscreen on, your body is not going to be able to create vitamin D. And a little bit later, we will go more into how you can safely get vitamin D from the sun. We can also get vitamin D from our food. Cold water oily fish such as sardines, salmon, herring, and mackerel all have a decent amount. Other seafood as well, egg yolks, and dairy all contain vitamin D3. Now, you may have noticed that every food I just mentioned was an animal product, and this is because there's actually no plant that contains vitamin D. There are some foods that vitamin D is fortified into, such as cereal, some orange juice, almond milk, but there's no plant that naturally contains it. And one important distinction to make is the vitamin D that is found in these animal products. It is vitamin D3, and the vitamin D that is fortified into these other foods, this is vitamin D2. When we look at studies that compare supplementation of the two, vitamin D2 only raises your blood levels marginally, and after 2 weeks, those blood levels have returned down to baseline, whereas vitamin D3 raises your blood levels significantly and has reached its peak after 2 weeks. The significance here is that vitamin D2 is not as effective as vitamin D3. The health benefits. Vitamin D is critical for so many functions within the body, including immune health, nutrient absorption, digestion, mood, memory, skin health, sleep, vision, heart health, bone health, blood pressure, fertility, weight control, and more. We will get to the importance of vitamin D with physical health in a moment, but first I want to talk about its importance with mental health. It is well known that lack of sunlight can cause seasonal affective disorder, a mood disorder also known as SAD. This affects more people than realize it during the winter months that live in colder climates, and vitamin D supplements can help. Research also shows that people with low levels of vitamin D are up to 11 times as prone to depression. Now, moving on to the physical aspects, vitamin D is also super important for calcium absorption. Without adequate levels, our bodies cannot absorb and use the calcium we are consuming, and this can lead to bones weakening and in some cases osteoporosis. Vitamin D can also prevent disease. Vitamin D supplementation has been shown to reduce the risk of multiple sclerosis, as well as heart disease, and even your chance of catching the flu. And this leads to how we can use vitamin D to help boost our immune system. Immune health. So how exactly does vitamin D support your immune system? Research shows that having normal levels of vitamin D can help to keep your immune system healthy. Low levels have been associated with an increased susceptibility to infection, disease, and immune-related disorders. Since the early 19th century, it has been known that both environmental vitamin D, so sunlight, as well as dietary vitamin D, cod liver oil, are an effective treatment for tuberculosis. Tuberculosis is a bacterial infection that mainly affects the lungs. Vitamin D has anti-inflammatory properties and is critical for the activation of immune system defenses. There is no denying the link between low vitamin D levels and an impaired immune system. In 2007, Time magazine cited benefits of vitamin D in its list of top 10 medical breakthroughs. So why are more of us not prioritizing it? Increasing vitamin D levels is so easy. Anyone can do it, and it's super effective. So how exactly do we increase vitamin D? We can get vitamin D from 3 places: from the sun, from our food, and from supplements. Earlier in the video, we talked about some of the foods that contain vitamin D, and while these can provide us some, the sun is really our best source. 20 minutes in the sun when UV rays are strong can generate 10,000 IU, which is a very significant dose. In comparison, 100 grams of salmon has a bit over 1,000 IU. Now, let's take a step back and talk about what dose of vitamin D is optimal. The RDA is set at 400 to 800 IU, but many top researchers believe this is set way too low. Like I said, 20 minutes in the sun can generate up to 10,000. Now, here's an interesting fact to take into consideration. The color of our skin determines how much vitamin D we can absorb. Lighter skin and we can absorb more, darker skin and we can absorb less. The reason behind this is that people whose ancestors lived near the equator, they were exposed to more sunlight and stronger sunlight throughout the year. Because of the stronger and more consistent exposure, they required less to be absorbed at once. On the other hand, people whose ancestors lived further away from the equator were exposed to less sunlight throughout the year, and therefore really needed to absorb all the vitamin D they could get. And this is why our skin gets darker the more time we spend in the sun. As our vitamin D stores fill up, we require less. Okay, so back to the question of what dose is optimal. If you are wanting to get vitamin D from the sun, your skin needs to be exposed. Nothing covering it, no sunscreen, and in direct sunlight. Now, we have all been told that the sun causes cancer, that we should cover up as much as we can when we are outside. But for every 1 case of cancer that is attributed to too much sunlight, there are 55 cases that are attributed to not getting enough. When I read that statistic, my mind was blown. Now, I'm not talking about sitting outside all day in the sun until you burn. If you're outside all day, then of course at some point you're going to want to put on sunscreen or cover up. But if you can get some uncovered exposure before that, your body will thank you. A good rule of thumb for how long to stay in the sun to get an adequate dose is for half the time it would take you to burn. Now, of course, this varies depending on where you live, the time of year, the time of day, and your skin tone. But the same rule works for all of these scenarios. Vitamin D supplementation. Now, if you cannot get adequate amounts from the sun, whether that be because of the time of year or you simply just can't get outside, you might have to supplement. Dr. 𝗖𝗟𝗜𝗖𝗞 𝗧𝗢 is one of the top experts on vitamin D. He has a book called Vitamin D, the Sunshine Vitamin, which is a wealth of information on this topic. Anyways, he recommends supplementing 4,000 IU of vitamin D3 every day if you have low levels. He also says that the fear of vitamin D toxicity is well overstated. This is pretty obvious just by the fact that you can go out in the sun for 10-20 minutes and generate so much vitamin D naturally. Dr. 𝗖𝗟𝗍𝗖𝗍, researcher at the University of Toronto, notes that vitamin D toxicity begins at 40,000 IU daily only after many weeks of use. Taking 10,000 IU daily for months at a time, provided there is no sun exposure, is perfectly safe. Blood levels can be done periodically to verify this. Personally, every day that I am not out in the sun, I supplement 4,000 IU of vitamin D3, and this is what works for me. This is obviously less in the summer and more in the winter. Anyways, guys, that is all I have for you today. Let me know in the comment section down below if you prioritize vitamin D. Do you supplement? Are you supplementing right now? Let me know down below. And if you want to check out my video on other tips to boost your immune system, you can click here. If you want to catch up on my most recent upload, you can click here. And if you're interested in starting a keto or carnivore diet, you can check out my coaching programs here. Thanks again, guys. If you made it this far, please remember to give this video a thumbs up and click that subscribe button. I'll see you next time. Bye, guys.